Joining us now on the Megacast are two individuals who are working together as well as their institutions to provide more nurses in our local area, as we have seen a bit of a nursing shortage across the board here in Michigan and around the U.S. over the last couple of years as a result of COVID-19, as well as other factors in the industry. Joining us now is Judy Didion, Dean of Science, Dean of the School of Nursing at Oakland University, and Stewart, Vice President and Chief Nursing Officer at Beaumont Health and Spectrum Health on the Megacast. Thank you both for being with us today.
Thank you. Glad to be here.
Appreciate having you both on. So let's start with you, Judy, as your institution, as Oakland University, has partnered with Beaumont Health and Spectrum Health on this issue. And in terms of getting students not only to go into nursing, but also to graduate from nursing programs, how important is it to have this partnership with a major local health institution to help them not only get into these programs more in depth, but have career opportunities, knowing they have career opportunities on the other side as they prepare to graduate from Oakland University?
Well, I want to thank you first of all, for inviting us to talk, but it's essential. Our having students have a pathway to move through their education, to be supported through their education, and to have an opportunity for employment is essential as we work with this nursing shortage. Individuals out there that want to move into healthcare, want to be registered nurses, really want to know how to get there. And I think this partnership with a major academic center is very important for us to provide this for our students, because we cannot educate registered nurses without their help. So I really appreciate our partnership and Anne's collegial work with us as we move through this new initiative.
In terms of the nursing workforce shortages, and how will this partnership with Oakland University help your institution bring more nurses in and provide support to those nurses that are already in your health system and in the industry that are feeling stressed because of the shortages?
Tyler, also, I thank you for having us. This nursing shortage certainly has been something we kind of waited for, and then it kind of hit us like a Mack truck. And what we need to do is think differently on how we bring nurses to the bedside. So this partnership allows us to help our students through their schooling. And then we commit ourselves not only to giving them the clinicals they need through those couple of years of nursing school. With 8 hospitals, we have a variety of different specialties and different hospitals they can go to. And then we will help them on their career path for those first 2 years, committed to making them an excellent Beaumont nurse as our other Beaumont nurses are.
We're joined by Judy Didion, the Dean of the School of Nursing at Oakland University, as well as Stewart, the Vice President and Chief Nursing Officer at Beaumont Health and Spectrum Health on the Megacast, as Beaumont and Oakland University announced recently a $20 million nursing investment for the program at Oakland University and for career paths leading to Beaumont and Spectrum Health. And they both join us on the Megacast at this time. And so, Judy, for Oakland University, how does this partnership benefit your program, the prestige of your program, but also the development of your nursing program at Oakland University to make it more competitive for students coming in and a higher quality education for those that are already in and will be coming into Oakland in the future?
Well, with part of this gift is an expansion of our current enrollment. And in order to expand our current enrollment, we do need more clinical spaces, which Beaumont will allow us to have for those students to educate in the live healthcare setting with patients. But we also needed to expand our lab. Our lab is very critical for our students to learn skills, to work through simulation, to really develop their critical thinking skills, understand how to interact with the patients at the bedside in a setting that's very safe. And so this infrastructure that we'll build will allow us to expand our lab, which will help us to add the number of students in our enrollment. It will also support us in terms of faculty. You know, one of the reasons for the nursing shortage is lack of faculty and and clinical resources. So we're really focusing in with this gift on alleviating both of those barriers. So for us at Oakland, this gift, not only does it provide financial support for the students who will enroll in the program, but it will also allow us to build an infrastructure that we can hopefully sustain and continue to have additional students enrolled in our programs, which allows us to graduate more new nurses in the workplace.
And then, Anne, for you on your side, it's one thing for an organization like yours to partner with a university and provide some insight into programs or additional career path opportunities or discussions with the students. It's another thing to invest faculty into Oakland University's programs, to make the financial investment that you did and the resource investment that Beaumont has into this program. For your organization, why make those great of steps to support a program like the nursing program at Oakland University? How does that overall benefit the future of Beaumont and Spectrum Health?
So as we have mentioned, there is a nursing shortage and we have to look at things differently. And this partnership really, over the next 5 years, we'll have 500 additional nurses that will be at the bedside caring for patients. And that is the ultimate goal. We need more nurses at our bedside. And this is an opportunity for the nursing students and the nurses to work together and really be able to care safely and compassionately for our patients.
So why Oakland University, from your organization's standpoint? Why that partnership with this university at this time among all the options that are out there? What about Oakland University made that the perfect institution for Beaumont Health and Spectrum Health to partner with in this effort?
Sure, I can give you just a general reason. You know, Oakland University has been a great partner for us. We are, geographically close. So many of our nurses have already been going to Oakland. I have 2 of my degrees through Oakland University. It is our community. Yeah, it's within our community, and it has just always been a great partnership. And this just really enhances that partnership.
We're joined by Ann Stewart, Vice President and Chief Nursing Officer at Beaumont Health and Spectrum Health, as well as Judy Didion, the Dean of the School of Nursing at Oakland University, on the Megacast. Judy, you mentioned earlier on some of the further investments in faculty and resource availability for Oakland's nursing program, but also part of this investment from Beaumont and Spectrum Health into your programs will include infrastructure. What sort of infrastructure changes or programs will be implemented for the nursing program at Oakland University as a result of this partnership with Beaumont and Spectrum?
Well, in order to add 500 students over the next 5 years, we really needed to build our lab, which I spoke about earlier. We're going to expand our simulation lab, add 3 simulation rooms, which really is cutting edge, but it's also important for our students to have that ability to work through simulation in clinical problem solving and critical thinking, so that when they move into the healthcare system as students, they're much more prepared to work with human beings and also provide safe and quality care, because that's essential. So lab will be one aspect. The other is hiring additional faculty. We will need to have more classroom space and more classroom sections, which will require more faculty, as well as clinical faculty, because when we send our students into the hospital, it is a 1 faculty to 8 student ratio. So with these additional students, we'll need to hire more faculty in terms of providing that education. And then, of course, we'll need to recruit faculty and work with Beaumont in terms of where they would like to emphasize that recruitment, because they have numerous healthcare facilities that have different shortage issues. So we will work closely with Beaumont and collaborate with them in terms of their priorities of where they need to fill this shortage. And with that, we'll be marketing to those areas. So we will hire a recruiter who will also do advising for these students and help support them along the way. There's one thing about recruiting students in, but we also need to provide all the wraparound services to support their success, because ultimately we want them to graduate, pass their board, to become a registered nurse, and then move into the workplace as smoothly as possible.
Judy, also earmarked in these investments are some funds for student scholarships as well. Can you speak about some of the additional scholarship funds that will be available to students as a result of this partnership?
Yes, half of the gift, $10 million, is geared towards student scholarships. And what we will have to plan out is how much scholarship per student. So if we want to expand our program with 500 students, that kind of, with the math, that kind of tells you about how much, possibly $20,000. Now, some students come in with additional scholarships, so we will kind of work with those students so that we can offset some of those scholarships and reduce any kind of burden that they might, have or potentially have to continue, to complete their education. So I can't say each student will get a certain amount, because it all depends on what other kinds of scholarships they're coming in with at the time. So, but we will use all of that money to fund student scholarships. And I think this is really important for nursing, because nurses coming out with student loans makes it tough for them. So having this gift really will not only recruit students that may not have thought they could afford to go to nursing school, but I think it will also provide them the comfort that they need in terms of moving into their first employment and not worrying about those loans.
Judy, Ann, appreciate both of your time and for telling us more about this great new partnership that will support so many nursing students here in the Oakland County area, and certainly many future nurses in Oakland County and throughout southeastern Michigan. Appreciate it.
Thank you.